Okay, so we were talking about behavior, right? So if you're good, your behavior is good. If you're bad, your behavior is bad. It's a reflection of your conduct, all right? Then we have the Braille system. The Braille system is for when a person cannot see, okay? And they have this system where they read words and vocabulary and grammar and everything with their fingers through some dots that are carved into paper or walls or whatever material, it doesn't matter. So this is the system they use to understand our language. Then we have genuine conditions, as we saw, okay? Genuine conditions is before we used to call it a disability or a discapacity. Right now, we do not call that anymore. We call it a genuine condition. And it's basically having a healthcare condition, because it's not a problem. It's a healthcare condition like blindness, like using a wheelchair, anything that doesn't permit you to act in your full potential. Okay, that's basically that. Then we have deaf or deafness. Okay, deaf means a person cannot listen to you. Okay, they cannot hear, they do not understand sounds. And for deaf people, we use our sign language. Okay, I think this is letter A on sign language. So that is a deaf person. Then we have a diagnosis. When you are sick or when you have a condition, you go to a doctor or you go to a hospital and they run tests, okay, blood tests or scanners or x-rays. And then the doctor can give you a diagnosis of what you have. If he tells me, okay, Miss Carla, you have a fever and you have, I don't know, high blood pressure. You need to take this and this and this medicine, okay? He already gave me a diagnosis of what I have because he is based on the results of the tests and exams he did to me, okay? Then we also have disorders. Disorders we have a lot of types of disorders, okay? We have genetic disorders, we have food disorders, we have lots of disorders, okay? I think you cannot see super clear on the picture, but we have different types of sicknesses. A disorder is basically a sickness, okay, that you have on your body. So when you have a disorder, you have a genuine condition, okay? And you need to take care of yourself. For example, cancer might be considered a disorder, or heart disease. Heart disease can be considered a disorder, okay? There are different types. Then we have a gene alteration, okay? A gene alteration means that genetically, one of your genes was not placed in the correct order, or it was altered in a certain way, okay? It did not form correctly. And so you are born with a genuine condition. Then we have mute people, okay? Mute people are people who cannot speak, okay? Words and sounds do not come off their mouths. Usually and generally, when you are mute, you are also deaf. Okay, not in all the cases, but generally. Then we have syndromes, okay? There are lots of types of syndromes, okay? Like Down syndrome. Down is a syndrome. And we have different types of syndromes on the skin or on our tongue or on our lungs, okay? There are different types of syndromes. It is also kind of it's not a sickness, because it usually cannot be cured, but when you have a syndrome, you usually have a genuine condition, okay? Then we have tests, or in this case, tests are blood samples or x-rays or scanning your body, okay? in order for a doctor to give you a diagnosis. So these are basically blood tests, okay? They put a needle on you, they take out some blood, and then they can analyze what's going on in your body. Then we also have therapy. Therapy is basically when you visit a professional like a psychologist or a psychiatrist, and you tell them because you feel that something's not right with you or something is not right with your life at the moment, and you need a professional's advice to tell you, to give you a diagnosis, to give you the correct medicines, to make you feel in a safe space where you can actually talk and you can express all your feelings and you can start making decisions on your life to have a better life quality. Okay. And then we have mental health, which I personally think it's super mega important. Okay. If you have anxiety, anxiety comes from biting your nails to having panic attacks. Okay. It can escalate very quickly. So if you have anxiety, if you have depression, if you have, I don't know, panic attacks, I think it is super important that we all go to a professional because our mental health is just as important as our physical health. Okay? It is important to say how you feel. It is important to express what's inside you. And it is important to be careful with our mental health, okay? Because if you don't have a good mental health, then your physical health will go down. We have autism. Autism is a genetic condition. I am not an expert on this topic. I'm just trying to explain what autism is. It's a condition where kids have some difficulty to adapting to our regular routines, okay? Because something in their mind is different than ours. I don't quite know what happens on their minds or what is it that they live, what condition do they live in, what's on their imagination. I really don't understand that because I'm no expert, but it is a condition and we see it more and more every day. So there can be levels of autism. I have students that have autism and they can perfectly talk and they can perfectly answer and they are super intelligent. And I have other students that have autism and they do not speak, but they listen and they understand what's going on in the class. So it depends like on a level of spectrum of, of the autism that somebody has, okay? Then we have the Asperger's syndrome. Okay, the Asperger's syndrome is also a condition. I'm not really sure how it works either because I'm not a doctor and I'm not expert on this topic. But it is also a syndrome. There was a video not long ago of a student that had Asperger's syndrome, and there was a teacher who was super rude to him on an online class. And I think we need to change that. Okay, this is another condition. Then we have Down syndrome. Down syndrome, if I'm not wrong, it's because of a gene alteration, because one of the chromosomes when you were on your mom's belly, okay, when she was pregnant, one of the chromosomes did not align correctly, and so you are born with Down syndrome. Down syndrome has this how do you say, these characteristics. So you have a small nose, mouth, and ears. You have almond-shaped eyes with skin fold covering inner corners, okay, like that. Then you have white spots on colored parts of the eye, slightly bent fifth finger, short, stocky build, and flat, round face, okay? So that's basically a description, a medical description on Down syndrome, okay? Then we have dwarfism. Dwarfism is a condition where you cannot grow as the average people do, okay? You stay very short. And we also have blindness. Okay, blindness is when we cannot see and we need help, as in a dog or a person or any other tool that can help me get by day. That is blindness. And then we have deafness, which we already saw deaf, but deafness is when you cannot listen. Okay. And I think we have one more slide. Okay, yes, one more slide. Then we have diabetes. Diabetes is very common, unfortunately, is very common nowadays. It's when you have resistance to insulin, okay, and that you cannot process sugars the way your body normally should. So you have to be injecting yourself insulin, okay, in order to have your sugar levels or your insulin levels correctly. Then we have obesity. Obesity in Mexico is country number 1 in obesity. It is not cool, but obesity is when you are like super fat because either you have a disorder or because your habits, your food and eating habits are not good. Okay. And basically, your exercise habits are not good either because you don't exercise, you don't eat well, you don't eat healthy, and then you can fall on obesity. Then we have anxiety. Anxiety, guys, this is what I was trying to tell you that I think it's super important. I personally have anxiety. Most people have anxiety. There are levels of anxiety, okay? From, like I said, biting your nails to, I don't know, shaking your leg, okay? That is a low level of anxiety. But then we have different levels, okay? We have restlessness, meaning that you cannot sleep at night, okay? You cannot rest, and it's awful. Then you have fatigue. Since you did not sleep, you are tired all day, you don't want to do anything, you want to sleep, but you cannot sleep. Then you have excessive anxiety and worry. You worry about everything. What's going to happen next? And what if I don't turn in my homework? And what if my mom gets sick? Okay. There are a lot of things that are in your mind and won't let you be in peace. Increased muscle aches or soreness. You start to feel like, I don't know, like sore. It hurts. Your body hurts in general. Then we have impaired concentration. You cannot concentrate in one thing because it is super hard because you have a million ideas on your mind. You are irritable, okay? Irritability is super common that you do not want people to talk to you. You want them to go away. And right now I cannot talk to you, okay? Because I have so many things on my mind. I cannot deal with your problems. And difficulty sleeping, okay? And there are other levels like panic attacks and other things. If you think, I say it because I care, okay? If you think you have a high level of anxiety and you do not know how to control it, I really advise you to see a professional because it's super important, okay? And then we have Alzheimer. Alzheimer is a condition when it usually presents itself with people that are older, okay, with third age people, and you start to forget things, okay? You start to forget who you are. You start to forget your family members. You start to forget where you come from or what you're doing, okay? So basically, you have memory loss. That is what Alzheimer is. We also have paralysis. A paralysis is when it can be in any place of your body, but when you cannot move certain part of your body. In this case, we have a woman that has paralysis on half of her face, okay? So she cannot move her eyes or her mouth. So it's a very difficult condition. It can be treated. Paralysis can be treated, okay? But sometimes it's irreversible, and sometimes you can actually revert it. So you can go back to your normal face again. It has a lot of like a lot of I don't know, reasons that can cause paralysis. Okay, so yeah. And then we have an amputee. An amputee, take a look at the girl's legs. One leg is different than the other because she does not have her natural leg. either because if it was a malformation or because she had an accident and she had to take her, they had to cut her leg, okay? But right now, nowadays, we have a lot of prostheses that help you to make your life as normal as possible and that can help you walk and run, even compete in the Olympics, okay? So an amputee is basically when they have to cut or they have to remove a part of your body because of a sickness or of an accident or a condition, okay?